Myself, Dr. Sandhya Gupta. I think quality improvement through translational research is important for nurse-managed patient-centered care. Translational research, the label has become ever more popular in biomedical domain in recent years. It is usually presented as an attempt to bridge a supposed gap between knowledge produced at lab bench and its use at clinical bedside. It's claimed to help society harvest the benefits of its investment in scientific research. The translational research is actually used in very different ways. It is important to disentangle and critically evaluate the different meanings of the label. Translational research is based upon diagnosing a gap that needs to be bridged. On one side, that gap are the life sciences producing enormous amount of knowledge and insight about health and illness on a molecular level. On the other side, there is clinical medicine, the domain that is expected to benefit from those scientific advances, but instead only sparsely progresses. So translational research is claimed to bridge these two sides. So areas of translational research could be basic research, patient-oriented research, population-based research. So when we are talking about nursing, in nursing, it is the community and the patient, people are very important. 6 different constructs are given here about the gap from various studies that are being reviewed. Number 1, new approaches or methods. Example, translating understanding into entirely new approach to therapy. Knowledge of the human body. The second, investigations in humans which define the biology of disease. Third, medical application. Translate more quickly the myriad discoveries in biomedical research into more effective applications relevant to human health and disease. Next, improvement of clinical practice. To improve the applications of scientific discoveries from the bench to actual patient care at the bedside. The fifth is benefit for the individual patient. So translation of scientific knowledge into patient benefit by quality nursing practice. And the sixth one is improvement of public health. From evidence-based medicine to sustainable solution to public health problems. How do we approach translational research? We have to just look at one example here about mental models. One of the things we can look out is mental model that can help succeed better, easier and faster. There are many. One of them is Pareto principle. It states that 80% of the result come from 20% of your efforts. It was discovered by economics, Pareto, over 100 years ago. Pareto looked around his life and noticed a pattern that 80% of the land was owned by only 20% of the people. But also that 80% of the peas in his garden were in 20% of the pea pods. This pattern seemed to be consistent across domains. Pareto said that for many events, roughly 80% of the effect comes from 20% of the causes. But this also implies that 20% of the results are coming from 80% of your efforts. When you stop and really consider the implications here, they are profound. One implication is that you can essentially stop doing 80% of what you do, and you will keep getting almost the same result. And no matter what, if you start looking at your life through Pareto principle lens, you will be surprised at how much you can let go of, freeing up your time, your energy, and giving you clarity and peace of mind. From research to reality, community engaged research is the real translational research. We have to involve the people who are actually on whom we are acting. That means the people. What is community and community engaged research? A group of people with diverse characteristics who are linked by social ties, share common perspectives, and engage in joint action in geographical locations or settings. It is important to remember when conducting community engaged research that communities are not homogeneous and seldom speak with one voice. Ask your community partner, how do you define community? So community engaged research is a framework or approach for conducting research. It's not a methodology in and of itself. It requires partnership development, cooperation and negotiation, and commitment to addressing various issues, exist on a continuum with much have variation in the strength and intensity of the community academic collaboration, depends on the research objective, project, participants, community history, and local politics, among others. At the care of all community engaged research in the understanding that the community will be involved in a meaningful way. So it can be less community involvement and investigator driven. It can be community based research, it can be community based research, it can be community based participatory research, or it can be community driven research. So here the community is completely involved. Nurse-led community engaged framework involves, for example, I have taken example of community health officer who is in health and wellness center. We have now 1.5 lakh health and wellness center. So there are various characteristics of the community and health indicators are there. So nurse-led community engaged framework will include outcomes, equitable partnership building, research capacity, trust, education and training, prevention of prevention of disease and non-communicable disease control, recruitment and retention, community outreach engagement, employment of community members. Of course, when we do research, it is important to tell others what you have done so that they can also take benefit of the findings. So publication in a reliable, important journals is very important to communicate with your other co-partners that what is going on. So how do you tackle this challenge? Encouraging government ownership through a local community convening platform is very important. What is the advantage of doing nurse-led translational research? It optimizes patient engagement, improve health outcome measurably, track results that demonstrate meaningful change. Nurse learns, apply, report on the efficacy of behavior change in ways that clearly show progress in person's journey and the associated health impact. Translational research identify which behavior science principles lead to specific actions to optimize future patient community. It also closes the gap in care, bring behavior change to the forefront of care delivery. Nurse helps to identify, mitigate high risk, high cost vulnerabilities along the care continuum by applying scientifically designed behavior change journeys to health status and nudge people to follow each step on optimal path, better care. And getting people to take healthy action is an age-old problem. Solving it starts by understanding how people really work. The old school approach is to tell people what they should do and hope it works, but it does not. Similarly, one size fits all or even segment specific efforts via sending messages or making phone calls don't move the needle much. A handful of targeted population responds while the vast majority move toward. So we have to have evidence. Non-communicable disease and their causes are known to us. And this should be the main focus for translational research for nursing. We very well know the connection of non-communicable diseases with tobacco use, with physical activity, with obesity, with unhealthy diets, harmful use of alcohol, malnutrition. We know this. Some of the stories I have brought here. Overview of the aims and management of chronic conditions. A survey of practice in nurse-led clinic for patients demonstrated that nurses are engaged in monitoring of disease status, examining, initiating, and interpreting investigations, referral to other specialists, providing emotional support, patient education, management of stable disease, management of patients on biologic therapies. The model for clinic for patient has been replicated to other centers. So this was one example of nurse is conducting clinic and also she's doing research. Another example is for diabetes control through M Health. So in M Health, there can be disease prevention, there can be disease management, there can be disease surveillance. So it's mobile-based application. Here we can talk about diabetes prevention. So all the health workers can be given this training. Then M disease management. Again, it is mobile based application. It will look after various aspects: situation assessment, stakeholder engagement, message development, refinement and testing, marketing and promotion, monitoring and evaluation. Then AM surveillance. That means using the impact, finding out what is the impact of using these tools. So the two types of cases are there: diabetic patient and pre-diabetic patient. So diabetic patient is given this instrument and asked to download the application, register themselves, receive daily reminders for measuring blood glucose and taking insulin, then receive regular advice on ways to manage diabetes through diet. Then what is the result? Happy, healthy diabetic with reduced A1C. Pre-diabetic individual is given the application, who receive initial outreach SMS engaging them in program. Individual reply with SMS, enroll in the prevention program. Individual receive SMS based advice on small changes they can make to reduce risk factors for diabetes, such as diet, exercise, etc. What is the result? A happy diabetic free individual. So the patient controls the disease rather than disease controlling the patient. So various health systems are there which enable behavior change journey at scale to improve patient engagement and move people to better health. So this is another example. Optimize patient engagement, close gaps in care, improve outcome measurably. So what is the value here? It's very important that application will really close the gap, bring change in the behavior of the people, delivery system. So get the right people moving in the right direction quickly by engaging them into this app. So active patient portal users are more engaged with their health. They are loyal to the providers and accountable for their own health outcomes. So we can explore various things and do a lot of work with community here. But of course, when we have application, computer-based application, phone-based application, internet-based application, we need to think of data security and privacy, and we have to learn how to do that. And the third-party system, we have to know how to maintain it. Example is seamless interoperability. So when we look at Arogya Setu, it's very easy to use cloud-based platform. Everybody can enter in that and ask questions and get benefit. Then behavioral design, you can have holistic patient experiential design. You can put certain questions and they can answer you. Then vaccination, you all of us know that vaccination you have to enroll on an app and then you can increase the vaccination use and you can decrease the vaccination hesitance. Another design is cross-sectional partnership model. So there we include telecom, insurance, pharmacy, pharma companies, wellness centers, IT industry, other private sector, government, local bodies such as panchayat, NGOs and academia. So they all will bring their best practices, their technology and their deployment strategy, their policies, all that we can bring together into one research, which will be translate in reality because everybody is a stakeholder. So that makes it more easy and viable and important. Development and implementation of nurse-led model of care coordination to provide health sector continuity of care for people with multi-morbidity protocol for a mixed method study. I have brought this example from Australia, where in phase 1, it was systemic review, stakeholders forum, validation workshop to collaborate and develop a model of care for nurse-led care coordination service was done. In phase 2, through series of iterative action research cycles that was planned to implement a nurse-led model of care coordination in multidisciplinary outpatient setting. The result was pilot implementation of the model of care in coordination commenced in October 2018 and March 2020. Nursing, clinician, and patient outcome and experiences with nurse-led model of care coordination will provide a template to improve continuity of care between secondary and primary healthcare system. The model template may provide a future pathway for implementation of nurse-led services both nationally and internationally. A PubMed search on COVID-19 and nursing highlights that the majority of the published papers reflect opinions on the impact of COVID-19 on nursing working arrangements, the nursing contribution towards care of patients with SARS-CoV-2, or the psychological and emotional burden borne by nurses caring for these patients, and the lived experience of nurses in China during the pandemic debut, depicting situations which would resonate worldwide. Nurses have partnered with many professionals and leading organizations to carry out activities during pandemic, understand the factors that optimize nurses' impact on improving health services, and chart a path forward to enable this momentum far into the future so that the nursing profession is well prepared to lead and help meet the evolving needs of our healthcare system. Public opinion is slower to shift though, and this partly because the media sometimes projects nurses not in best light, and nurses are trying to get the word out that they have to be better educated, that most nurses are educated to a bachelor's level at minimum. The general public trusts nurses and things are changing, but people don't understand the type of education nurses have to go through. Now, another example is what place does nurse-led research have in COVID-19 pandemic? The impact of COVID-19 on bedside nurses, stressing gaps in human and material resources and an emotional toll comparable to what disaster and first responders experience. It would not be surprising then that for the exhausted and scarce nurses availability on the clinical front line, engaging in research may appear as an unreachable aspiration. These research experiences certainly make an important contribution to understanding the pandemic, but high quality nurse-led interdisciplinary research is required to shape contemporary clinical practice and expand professional boundaries. Effective treatments are still few, and supportive care remains the cornerstone of therapeutic management. During pandemic, the nurses could not do any interventional studies. The silver lining of COVID-19 is that it changed the practice and delivery of healthcare in a fundamental ways, with a significant impact on nursing profession. As nurses answered the call for crucial healthcare leadership, long-standing barriers were broken down, policies shifted, and innovative new approaches were developed. While our healthcare system has been ripe for change, the pandemic exposed the areas of opportunity and opened a door for new thinking that we need to examine and continue to push forward. Despite the lack of public knowledge about what it means to become educated as nurse, people trust nurses, and this can have a positive impact on patients' understanding and acceptance of research-based information. After research experience, nurse looks at things completely differently. When they read articles, for example, they will not take the findings for granted, but look at how they did the research, the methodology. Is it sound? Are there flaws in the way they collected sample or set up the study? Or did they use unreliable tool? That kind of critical thinking means filtering information before passing it on to patients. In fact, doing research changes the way they interact with patients. There is already a lot we know about patient care from evidence generated by nurses, and this is likely to increase in future. At hospital, there is need for endowment fund to provide grant for nurses to do research. So I would conclude that quality improvement is best achieved by nurse-led translational research, patient-centered care. Cross-sectional partnership model is best for nurse-led translational research work. Community involvement and patient is important as partner that leads to quality. Of course, the way forward is nurse-led translation research for quality improvement in patient-centered care is a move that signifies a growing recognition for expanding role of nurse practitioners in the community. Thank you very much.